So this morning I chose to display two cases that really I kind of think show the difficulty sometimes in picking the appropriate device for the appropriate clinical situation. And I think over the last several years, we've seen a clear uptick in the number of devices that are available to us. And I think we're all trying to figure out which device works best in certain situations. And this Pounce Thrombectomy catheter is clearly one of these devices with capability. And I'm going to show you two cases that kind of depict my struggle. So the first case was of an ischemic leg. It's a 74-year-old gentleman, and he had about a 4-week history of left calf claudication. His past medical history was significant for previous aneurysm repair via EVAR, so an up and over approach to the left leg wasn't possible, coronary artery disease, and as you can see on the right, his ankle brachial index on the left was reduced at 0.37. The right side was normal. And the CT angiogram that I've shown you here depicts that filling defect through the left popliteal artery. And I think this is a fairly common clinical presentation for people with popliteal artery occlusions or embolizations. They often don't show up to the ER on day 1 or day 2. Symptoms are not quite as severe, and I've seen numerous of them present in this way, sort of in a delayed fashion. So he was taken to the catheter lab, and his diagnostic angiogram is before you. So it shows occlusion and no flow through the P3 segment of the popliteal artery, and occlusion of the entire tibioperoneal trunk, but you can see the proximal aspects of each of the tibioperoneal arteries. So in my mind, as a popliteal embolus, I started with a device that we'd had around longer. I chose Penumbra, the Lightning Bolt 7 French device, not the 8 French, which I'd had good success with on some previous popliteal emboli in years past. But my first strategy was aspiration thrombectomy. And so I put the device in, we made several passes. I was able to advance the catheter into the clot, but I literally got nothing out of it. So this is a pre and post image after multiple attempts at aspiration. It didn't work, and so you move on. You pick another strategy. So Pounce, this thrombectomy catheter, is newer to our lab, but we've had some great successes with it. We pulled it as the number 2 device. It's a 7 French device, and as you can see on the pictures here, I first sent the catheter, which you position past the clot. I put the catheter down the anterior tibial artery and made a pullback from the anterior tibial artery and through the popliteal artery. And just with a single pull through there, recovered significant amount of thrombus. As you can see on the right-sided picture, I still have residual thrombus in the tibioperoneal trunk. Obviously, in a case like this, not just one pull is going to suffice. So we targeted that next. And on the right is a video depiction of how this goes. So that's me pulling those 2 nitinol baskets through the tibioperoneal trunk. You pull it slowly, you pull it into the funnel, and then you take them out together. And this now subacute thrombus is what we recovered from this gentleman. The completion arteriogram is seen on the right side. Fortunately, there was no distal embolization from either the event or the procedure itself. And at the end of this procedure, which probably took an hour or less, he had a nice pink reperfused foot. His pedal pulses were palpable. And he's now had 3-month follow-up where his ankle brachial indices once again are normal. So a nice depiction, I think, of how this device, as maybe a more mechanical, more robust device for subacute clot in a gentleman for whom had this been sitting there for nearly a month, was probably the right choice from the begin with to use as the thrombectomy device.